Hello everyone, welcome back to our channel. Today I'll discuss with you some of the MCQs from Community Health Nursing. Question number 1. Epidemiological traits are all included except option A, host, option B, environment, option C, agent, option D, investigator. So first of all, we should know what is this epidemiological traits. It is one of the traditional models for depicting the causation of disease, and it is one of the simplest among all these models. So what is it included? It includes the susceptible host, the agent, and the favorable environment. So all these three factors, they depend with each other for the causation of disease in the susceptible host. So here the question, it says are all included except. So here option D, we can see investigator does not included in this epidemiological trait. So the correct option is option D. Question number 2. Zero incidence is option A, elimination of disease, option B, eradication of disease, option C, elimination of infection, option D, eradication of infection. So zero incidence means it refers to the elimination of disease. So the correct option here is option A. And first of all, we should know what is the meaning of elimination of disease. It refers to the reduction to zero or low defined target of new cases. That means in elimination of disease, the preventive measures still have to carry on so that there will be no reinfection or retransmission of disease. What does eradication means? Eradication means refers to complete or permanent reduction, worldwide reduction to zero new cases. So if the disease has been eradicated, so no further control measures are required. Unlike elimination of disease, control measures should be carried out to prevent re-establishment of disease transmission. Question number 3, immunization is option A, primary prevention, option B, secondary prevention, option C, tertiary prevention, option D, disability prevention. First of all, we should know what is primary prevention, what is secondary prevention, what is tertiary prevention, what is disability prevention. Primary prevention is the approaches which focus on preventing the disease or preventing from disease to develop. Okay, secondary prevention is an attempt to detect disease at an early stage and intervene at an early stage. And tertiary prevention is the type of prevention or it's the management of the already established disease so that there will be no disability in the person. So immunization falls under option A, which is primary prevention. Question number 4. Silent epidemic of the century is option A, coronary disease, coronary artery disease, option B, chronic liver disease, option C, chronic obstructive pulmonary disease, or option D, Alzheimer's disease. So the correct answer here is option D, which is Alzheimer's disease. It is known as the silent epidemic of the century. Question number 5. The disease imported in a country which was not otherwise present. Option A, epoonotic disease. Option B, zoonotic disease. Option D, exotic disease. Option D, epizootic disease. So what is epoonotic disease? It is the outbreak of disease in bird population. In bird population, it is the outbreak of disease in bird population. And zoonotic disease, it is disease type of disease that's transmitted from animals to human. And what is exotic disease? Exotic disease is the type of disease that is imported in a country which was otherwise not present. So the correct option here is option C. And what is epizootic disease? Epizootic disease is type of epidemic outbreak of disease in animal population. Epidemic outbreak in animal population, and this epidemics may extend to humans too. 6. First case which comes to notice of physician. Option A, primary case. Option B, index case. Option C, secondary case. Option D, refer case. So the correct option here is option B, which is index case. So what is primary case? Primary case refers to the person who brings the disease into the group of people. That is called primary case. And index case is the first identified case. And what is secondary case? Secondary case is defined as an individual who contracted the disease through exposure. So imagine there is group of people here. And there is one person here. So this person he might brought the disease into this group of people, and this person, it's called primary case. And this person may bring the disease into this group of people, and so maybe this person get infected, and this person develops some signs and symptoms and is identified by physician. So it's called index case, or it can also be called secondary case because it contracted the disease through this person. And in this case, the primary case may not be known because it does not show the sign and symptoms. So in this case, the primary case may not be known which one is the primary case. Question number 7. The freshly prepared ORS should not be used after option A 6 hours, option B 12 hours, option C 18 hours, option D 24 hours. The correct option here is option D, which is 24 hours. So after we prepare the ORS, we should use it before 24 hours. After it crosses 24 hours, we should throw it, or we should not use it anymore. Question number 8. What number of sputum specimens collected to diagnose tuberculosis in dots? Option A 3, option B 2, option C 1, option 4 4. So the correct option here is 3. In dots, we should collect 3 samples of sputum. First it's spot sample, then after that morning sample, then again spot sample. 3 sputum samples is needed to diagnose tuberculosis in dots. Question number 9. Flaccid paralysis, fever, sore throat, constipation are the manifestations of option A, diphtheria, option B, tuberculosis, option C, polio, option D, renal tumor. The correct option here is option C, which is polio. Question number 10. The humoral immunity is based on option A, production of antigen, option B, production of antibodies, option C, formation of vaccines, option D, all of the above. So the humoral immunity, it is the process of adaptive immunity manifested by the production of antibodies. So the correct option here is option B, which is the production of antibodies. Question number 11. Rashes of chickenpox first appears on option A, trunk, option B, face, option C, arm, option D, legs. So the rashes in case of chickenpox, it first appears on the trunk, which is one of the characteristics of this disease, chickenpox, which we can differentiate it from the measles. So chickenpox first appears on the trunk of the body. Question number 12. Rashes of measles first occur on option A, trunk, option B, face, option C, hands, option D, legs. So the correct option here is face. In case of measles, the rashes first appears on the face of the person. Question number 13. Blood sample from a patient with malaria should be collected at option A, at the peak of fever, option B, after taking meals, option C, when fever is just started, option D, when temperature is normal. So the correct option here, it's mostly the blood samples of patient with malaria is collected at the peak of fever. When the fever is at peak, so at that time the blood samples should be collected for testing malaria in that patient. Question number 14. Sunken eyes, hollow cheeks, subnormal temperature, decreased urine output, washes man's hands are the features of option A, measles, option B, dehydration, option C, polio, option D, over dehydration. So the correct option here is option B, which is dehydration. Question number 15. The aldehyde test of Napier is used for the diagnosis of option A, measles, option B, dengue, option C, Kala Azar, option D, pneumonia. So this aldehyde test is used for the diagnosis of Kala Azar. So the correct option here is option C, which is Kala Azar.